The Holy Family Center in Monze, Zambia provides a variety of holistic services to children and adults with physical disabilities. Having opened its doors in 1986, we now take a look at some of the life-enhancing services available through the center. The Early Childhood Development Program, income-generating activities, the Rehabilitation Center, and the Outreach Program. Central to the work of the Early Childhood Development Program is the Early Childhood Intervention Program. We work closely with local government employees to identify, assess, and provide services for children with disabilities.
We are assisting these children by identifying them and providing activities that are designed to assist them in preparation to have them join an inclusive learning program within the regular education system in the country. At the moment, there is no other institution that is providing such a service within the country. Early childhood intervention has two divisions. One is 0 to 3, home-based program. Children learn very well in their home environments, and their parents get involved in this program. While the 3 to 7 looks at the early introduction to schooling programs, so that a continuous program of assessment is inducted so that children are monitored and prepared for inclusive education. One of the greatest challenges that we are faced with is we do have insufficient resources running from human resource and financial support.
Parents are partners in the therapeutic work we undertake with the children in the Early Childhood Development Program and are central to its success. Mothers meet monthly to share their experiences. Mothers are given food supplements as well as resources such as chickens to generate their own income.
A project yesu yagataliga mu 2009. Kuzwa mu 2009 kusigira mu 2012 twahuba nkugu age jabaja number 5. So twahuba nkugu inga profit twatyani twabana then capital yali mu twatyani to dahimbi. So a project yatugwaha ikugwahiri abana besu ibalema.
A variety of conditions are treated at the Rehabilitation Center, ranging from injuries caused by road traffic accidents to shooting incidents and snake bites.
At our center here, most of our patients comes for rehabilitation from different parts of the country. We do work hand in hand with Monze Mission Hospital, and most of our patients comes from Monze Mission Hospital. Apart from Monze Mission Hospital, we do receive patients who are coming as far as from Lusaka, coming for rehabilitation here. We have our bed capacity of 30, and in average we can receive about 20 or 25 patients. So they go home happy, and some we do follow them as a outpatient. We give them program where they can be coming for some checkup.
The orthopedic department with its prosthetic workshop is an important part of the rehabilitation service. Here, tailor-made artificial limbs are made for specific patients.
My name is Sidney Ngluta. I'm an orthopedic technician. My role here is to make sure that all artificial limbs are made in this workshop. We work in collaboration with Hospital Monze in a way that they bring clients here or they refer clients here who are amputee and who are disabled or who have the scoliosis or kyphosis deformity.
The Rehabilitation Center also offers physiotherapy treatment, which greatly improves the quality of life for many patients.
What rehabilitation program does, it helps to restore a patient's ability to as normal as possible following an injury or a disease. There is great need for rehabilitation in Monze because there are various forms of disability, not in Monze, but in the country as a whole. Patients don't go directly to Monze because Monze Mission Hospital, they only deal with acute cases.
Okay, 3 up. Okay, very good.
The greatest success that we have had in rehabilitation is one of our clients, James, who was referred to us in June last year as a result of paralysis of all his 4 limbs following a tumor in the neck. When he was referred to us, he was bedridden and he was not able to do just about everything. But we managed to at least get him to stand and for him to start walking. As at now, he's able to walk using a pushing frame and he's able to go wherever he wants to go. The greatest challenges that we have had in this program are lack of manpower and few equipments. But otherwise, the program is running very well and we are able to manage with whatever we have as at now.
The Rehabilitation Center also refers patients to Monze Hospital in order to be treated by orthopedic specialists who visit from the capital, Lusaka, every month. Services provided by the Holy Family Center also extend beyond the center itself. The center runs an outreach program whereby special education teachers, a team of doctors, and social workers visit remote villages to provide treatment.
Before we begin the outreach, we did a needs assessment, and from the needs assessment, we found out, or it revealed that there was need of the services that we offered at Holy Family Center to be extended to remote places. We could not do this alone, and so we involved the community. We trained community-based volunteers. So far we have 9 of them in various centers. And they do visit these people and identify persons with disability. And then we do the actual work. We have been doing this program for about 4 years now. People that benefit from this outreach are typical villagers who are poor and are unable to access such facilities. If this program was to come to an end, you would see a rise in the number of people that have disabilities in our community. Initially, when we began, we had about 7 centers, but as of now, we've extended to other centers, and so far we have 8, and we are planning to extend because such services are needed more in these remote areas.
The outreach program is unique in Zambia. In between outreach clinic visits, special trained volunteers support parents with their children's recommended physiotherapy exercises. The volunteers come from the areas visited and are easily accessed by local people.
Ina langu ni mairi ni hangoma. Mwana ngusa ni makusu. Bauhimba Victor makusu. Tukala munzi mohijepa. Imwana oyu naga halwa ogali mutetete. Ogali kujengulwa gonse. Ogali kunkansi. Ijikelo. Wina naga sikite kule 10 kg pepe. So nindaga lema kutola kuchipatira wandabona kuti malandi manina. Nagatalika kulomba uli babanda bakumonzi. Talika umishini kuyenda kuti ani ikutola mwana. Bweno obubata yabalundi chani kundi kwaira bweno obutubinzi tamweno bundi achira mwana wangu akundi hamegi size nimusira mwana otyani oba bo butindaga yutina mwana ngotyani ngoyu mayuma bo bupepe kusigire kino chindibya ndile utibya kamuzumana na muji ampera no bantu baleza ebi andalumba maningi pondi simpira.
The Holy Family Center plans to extend its outreach services so as to help even more adults and children with disabilities. A new child development center is already under construction, and we hope it will open its doors in August 2013.